So many older women silently wonder, what's that smell? Is it me? They don't ask out loud. They're too embarrassed, too uncertain. They sit in quiet shame, assuming it's just part of growing old. That maybe this is normal. That maybe no one else notices, or worse, maybe they do. But let me tell you the truth. It's not just aging. It's not just your imagination. And it's not something to ignore. Could be your body trying to tell you something. Something important. Something it's been trying to say for years, softly, gently, patiently, while the world looked away. And now it's time to listen. Because this isn't about embarrassment. It's about clarity. It's about health. And it's about reclaiming ownership of a body that's carried you through decades of storms, sacrifice, and survival, and still deserves to feel clean, confident, and whole. If you're over 60, and you've noticed your body changing in quiet, confusing ways that no one ever told you about, you're not the only one. If you've ever sat alone in your bedroom wondering why certain things feel different, or why your confidence slips just a little more each time you catch a faint, unfamiliar scent. If you felt ashamed or nervous, or like maybe you're losing control over the body that's carried you through so much. Please hear me when I say this, you are not alone. This space, right here, this very moment, is yours. It's safe. It's judgment-free. It's real. Because somewhere along the line, the world stopped talking to women once they passed a certain age. Doctors became rushed. Conversations got awkward. Society moved on. But your needs didn't vanish. Your health didn't pause. We're going to talk about feminine hygiene as we age. About why the body begins to smell differently. About what those changes really mean. And about what you can do today to feel better, clearer, and more in control. This isn't about shame. This isn't about hiding or apologizing. This is about understanding. About grace. About clarity. And most of all, it's about confidence. Because aging doesn't strip you of your power. If anything, it gives you more once you know how to use it. Habit number 1. Poor hydration. You'd be amazed how many women, strong, beautiful women, spend decades taking care of everyone else, but forget to nourish the one body they've always had. Let me ask you this. When was the last time you really paid attention to how much water you were drinking? I don't mean coffee or tea. I'm talking about real, clean water. Because here's the truth. Dehydration isn't just about feeling thirsty. It quietly affects everything. Your energy, your digestion, even the natural chemistry of your body. And yes, that includes how you smell. When your body isn't getting enough water, waste products, things your body is supposed to flush out, start to hang around longer than they should. Your kidneys slow down. Your sweat becomes more concentrated. And guess where that shows up first? In the places with the most delicate balance. That includes your private areas. The body is smart. But without enough water, it simply can't do its job. That can lead to a subtle, sour odor. Or sometimes even a sharp, unpleasant scent that feels off. Not like you. If that sounds familiar, I want you to meet Mary. Mary is 68 years old. She lives alone, loves gardening, and swore she wasn't a water person. She'd go through entire days with just coffee in the morning, a soda at lunch, and maybe a glass of juice if she remembered. And for years, she noticed something off, faint smell. One she couldn't wash away. She blamed her age, her hormones, her soaps, but nothing helped. Until her doctor asked her one simple question, how much water do you drink? She didn't know, so she started tracking it. 1 week later, Mary made a change. 8 cups of water, every day, sometimes with a lemon slice, sometimes with cucumber and mint. She made it part of her morning walk, her reading time, her quiet evenings. And within a month, the smell? Gone. Her energy improved. Her skin looked better. And most of all, she felt in control again. Not confused. Not embarrassed. Just clear. Have you ever tried tracking your water intake? Not guessing. Not estimating. Actually writing it down? Try it. Just for 1 week. You might be surprised. And if plain water doesn't excite you, spice it up. Add a slice of lemon, cucumber, even frozen berries. Make it feel like a ritual, not a punishment. Because hydration isn't just about thirst. It's a form of self-respect. It's your body's way of saying thank you for paying attention. And if you've ever felt like your body was betraying you, maybe it was just trying to get your attention. Now, I want to hear from you. Be honest, how many glasses of water do you usually drink each day? Do you track it? Have you noticed any difference when you drink more? Drop a comment below. Someone might really need to hear your story. Habit number 2, wearing synthetic underwear. Let's talk about something most women don't think twice about until it starts to cause problems. What's the very first thing your skin touches every single day? Your underwear. And yet, we almost never question it. We wear what we've always worn, what looks pretty, what fits, what's on sale, what came in that multipack we grabbed without a second thought. But here's what no one tells you. Synthetic underwear, especially the kind made from polyester, nylon, or spandex, doesn't just affect comfort. It can directly influence odor and hygiene. Those fabrics trap heat, they trap sweat, and they create what doctors call a closed environment, a space that doesn't breathe, doesn't dry properly, and ends up becoming a breeding ground for bacteria. Now, you may not see anything. You may not feel anything at first. But over time, these tiny changes can throw off your body's natural balance. That includes pH shifts, moisture buildup, and yes, unwanted, lingering smells that soap alone can't solve. Your body was designed to breathe, especially the delicate areas that rely on airflow and dryness to stay healthy. And guess what helps the most? Cotton. Simple, soft, breathable cotton. Not fancy, not synthetic. Just clean, natural fabric that lets your skin do what it's meant to do. I had a woman email me last year, Sandra, age 72. And it's not just underwear. Think about your sleepwear. Are you sleeping in tight-fitting leggings or silky blends that don't breathe? Or are you letting your body rest in something loose and airy? Doctors have a phrase for it. Open environments support hygiene. It's not about looking sexy. It's about feeling clean, feeling free. Ladies, let me ask you, what kind of fabric do you prefer for comfort? Be honest. Not what you think you should wear. What do you actually wear every day? Drop it in the comments. Let's get real. Because when we talk about this stuff openly, without shame, we learn from each other. Switching to breathable fabrics doesn't just change how you feel, it changes how you see yourself. It's not about being perfect. It's about giving your body the basic support it needs to thrive. And maybe, just maybe, it starts with a drawer full of soft cotton. Habit number 3, ignoring subtle health changes. Let me ask you something a little personal. Have you ever felt a strange sensation in your body, maybe a little itching, a change in scent, a bit of discomfort, and told yourself it's probably nothing? I'm just getting older? That's one of the most common habits I see in women over 60. We brush things off. We tough it out. We normalize discomfort. But just because something is common doesn't mean it's normal. And when it comes to your health, especially your intimate health, those little signs are worth paying attention to. Let's talk about what actually might be going on when your body starts to feel off. You may have heard of things like BV, bacterial vaginosis. It's not a fancy term, and it's definitely not rare. In fact, millions of women get it every year, especially as hormone levels change in midlife and beyond. There's also yeast infections. They're not just for younger women. In fact, menopause can make you more vulnerable to them because your body's moisture balance shifts and natural defenses weaken. And let's not forget UTIs, urinary tract infections. They don't always come with burning or pain. Sometimes they just bring a sense of heaviness, a change in smell, or even confusion in older adults. All of these are treatable, but only if you notice them, only if you take the signs seriously. Now let's talk about something that doesn't get enough attention: pH balance. The pH level in your intimate area is incredibly sensitive, and when that balance is thrown off, by soaps, by sweat, by diet, even by stress, your body reacts. That can show up as an unusual odor, a change in discharge, or just a general feeling that something's not quite right. But here's the thing, most women ignore these signs. We've been trained to. We were told as girls not to talk about down there. Told as mothers to put everyone else first. Told as aging women that we should expect to fall apart quietly and accept it with grace. But grace doesn't mean silence. Grace means listening to your body. And when something changes, especially something that affects your confidence, your comfort, or your daily life, it's time to pay attention. Doctors say it clearly, early detection is key. That strange scent, that mild irritation, it might not be just aging. It might be your body asking for help before things get worse. There is power in catching things early. There is dignity in refusing to suffer in silence. And sometimes all it takes is a simple checkup. A conversation, a test, a treatment. Let me ask you this, have you ever brushed off a symptom only to look back later and wish you'd said something sooner? If you're brave enough to share, drop it in the comments. Your honesty could help another woman feel seen. You deserve answers. You deserve comfort. And most of all, you deserve to feel good in your body without apology. You've lived too long, loved too hard, and grown through too much to ignore your needs now. It's not weakness to ask questions. It's strength. It's not shameful to seek care. It's wisdom. And it's not just aging. It's your body still speaking, still guiding you, still asking you to listen. Now, let's take a moment to step back and hear from the people who spend their careers looking into this every single day, gynecologists and urologists. Not influencers, not hearsay, real experts. Dr. Elaine Morris, a board-certified gynecologist with over 30 years of experience working with women in their 60s, 70s, and beyond, said this in a recent interview. The number one misconception I hear from my older patients is that odor is just a hygiene issue. It's not. In most cases, it's hormonal. It's bacterial. It's internal. She went on to say infections don't always scream. Sometimes they whisper. And older women have been taught for too long to ignore those whispers. Let that sit for a moment. Your body doesn't always shout when something's wrong. Especially as we age, the symptoms become softer, subtler. But the message is still urgent. Let's break this down. Here are the most common causes of odor in women over 60, straight from the medical community. Hormonal shifts. After menopause, estrogen levels drop. That leads to thinning of the vaginal walls, reduced lubrication, and an environment that's more vulnerable to infection and imbalance. Reduced immunity. The body's natural defenses slow down over time, which makes it easier for bacteria to overgrow. Even if hygiene habits haven't changed. Underlying health conditions, diabetes, certain medications, kidney issues, and even dietary imbalances can alter your body's scent from the inside out. Chronic infections or recurring BV. These are often misdiagnosed or mistreated, especially in older adults. What starts as a mild imbalance can turn into a recurring issue if not fully addressed. But here's something no one tells you in the drugstore aisle. Sometimes the issue isn't external. It's not the soap you're using. It's not how often you're showering. It's not even about being clean enough. It's internal, and no amount of surface-level scrubbing will fix it. That's why doctors urge women to stop self-blaming and start asking better questions. When should you actually see a doctor about odor? Here's what the experts say: if the smell is persistent even after good hygiene. If there's an unusual discharge, yellow, green, or frothy. If there's discomfort, itching, or dryness. If there's a burning sensation during urination. Or if something just feels off. Your intuition matters. If you feel like something isn't right, trust that. Now let's talk about what actually works. A lot of women rush to over-the-counter OTC products. Sprays, wipes, deodorants, thinking they'll fix the problem. But here's the truth, those often do more harm than good. They can mask symptoms. They can disrupt pH even further. And they can delay real treatment. Instead, most doctors recommend prescription treatments when necessary, like antibiotics for infections, antifungals for yeast, or hormone creams for severe postmenopausal dryness. And sometimes the solution is as simple as a pH balancing gel or an internal probiotic designed specifically for vaginal health. The key is, don't guess. Don't go silent. Don't self-treat for months before getting answers. I know it can feel awkward. I know there's still a stigma. But here's the truth, you're not being dramatic. You're not being vain. You're being wise. Because ignoring symptoms doesn't make them go away. And treating your body with respect, especially now, is the most radical form of self-care. Let me ask you this. Have you ever tried an over-the-counter product that just didn't work? Or made things worse? Or did you finally get relief only after talking to your doctor? Share your story in the comments. Your experience could help another woman take that step without fear. You're not alone. And the more we talk about these truths, the real ones, the hard ones, the more we normalize aging with awareness. Because yes, the body changes. But we're still allowed to ask questions. We're still allowed to feel good. And we're still allowed to expect answers. So now that we've uncovered the why, let's talk about the how. How do we move from confusion to confidence? From uncertainty to daily peace of mind? It's not about reinventing your life. It's about making small, steady shifts that honor your body every single day. Let's walk through a daily checklist together. Something simple, gentle, nothing overwhelming. Just a few steps, 5 minutes or less, that can protect your health and help you feel refreshed, balanced, and in control. First, stay hydrated. I know we hear this all the time. But here's the truth, hydration isn't just about quenching thirst. It's about supporting your body's ability to flush out waste, keep tissues moist, and maintain the delicate balance of your internal ecosystem. 8 cups a day might sound like a lot, but try this. Start your morning with a full glass before anything else. Carry a bottle with you throughout the day. Add lemon, cucumber, mint, whatever makes it more enjoyable. Just sip, slowly, with intention. It adds up. Now, choose breathable clothing. This one's overlooked, but it makes a difference. Synthetic fabrics, especially when tight, can trap heat and moisture. That creates the perfect breeding ground for bacteria. Swap out your underwear for cotton. Choose loose-fitting pajamas. Let your skin breathe, especially at night. Even something as small as switching to looser sleepwear can make your mornings feel fresher. Next, practice gentle hygiene. No harsh soaps. No douching. No fragrances. Your body is smart, it has its own natural balance. You don't need to scrub it into submission. In fact, that often does more harm than good. Use warm water. A mild, unscented cleanser if needed. Soft cloths. Avoid wipes with alcohol or perfumes. Be kind to yourself. And here's the most important piece. Don't delay your doctor visits. I know it's easy to push things off. You're busy. Or maybe you don't want to seem like you're overreacting. Maybe you've even had doctors dismiss you in the past. But your health is worth the follow-up. Every time. If something feels different, say something. If odor persists, ask why. If a symptom doesn't go away, don't wait. You are not being a burden. You are being your own best advocate. And I want to make this even easier for you. In the description of this video, there's a link to a free printable hygiene calendar. No strings. No sign-ups. Just a helpful little tool you can keep on your fridge or bathroom mirror. It's got space to track water intake, note changes in symptoms, and remind you when it's time to book your next checkup. Think of it as a quiet partner in your daily care, always there, always supportive. Take a breath with me. You've learned a lot today. You've honored yourself by listening. And the most powerful thing? You're already on your way. Because prevention doesn't start with a product. It starts with paying attention. It starts with gentle care. It starts with you. So, out of curiosity, what's one habit you're going to start tomorrow morning? Leave a comment. I'd love to hear. And chances are someone else reading will be inspired too. Let's keep helping each other stay informed, stay confident, and stay connected. Subscribe, like, and share. You are not too old to take control of your health, your peace, and your body. You are still blooming. And this video is proof that you're not alone.